Knee replacement surgery is most commonly performed on patients who have advanced osteoarthritis of the knee. It is the end stage for osteoarthritis. It's an operation that works very well. Most people are very happy that they've had this operation because they can return to activities without pain, without taking pills. They can return to tennis, golf, swimming with no restrictions. What happens in osteoarthritis is that the articular cartilage degenerates, and articular cartilage is very, very smooth. Bone is not. Once the articular cartilage has worn away, you have bone rubbing on bone, which is quite painful. So the patient will notice that he starts to lose range of motion in his knee. He may have some mild swelling of the knee. He may have increased pain after walking short distances. The typical patient who has knee replacement surgery spends 2 to 3 days in the hospital. At the culmination of the 2 to 3 days, they go home, and we usually make arrangements for a nurse and a therapist to see them at home. And the recovery varies from patient to patient, but by 6 weeks, most patients are doing very well and have returned to their normal level of activity. Here's a normal knee with intact articular cartilage. You can see that the cartilage is very smooth. There's a good joint space between the femur and the tibia. Here you see a knee with advanced osteoarthritis. You see that the cartilage has wasted away. There are spurs. There's decreased articular joint space. If we look here, you can see a patient, an x-ray of a patient with advanced osteoarthritis of the knee. There is no joint space here. The two bones are touching. Hip replacement surgery is done most commonly due to end-stage osteoarthritis of the hip. Osteoarthritis of the hip is basically the wasting away of the articular cartilage. Articular cartilage is very smooth, bone is not. So once the articular cartilage has wasted away, you have bone rubbing on bone, which can be quite painful. This can lead to decreased range of motion in the hip, pain with walking, difficulty performing normal activities such as putting on your socks or tying your shoes. Hip replacement surgery is usually done at the end stage of osteoarthritis. Once more conservative care such as anti-inflammatory medication, weight loss, once these things aren't working, then the patient is considered for hip replacement surgery. Osteoarthritis of the hip can be very incapacitating. I have patients that have come in a wheelchair because they can't walk, they become debilitated. The important thing to know about this is studies have shown that people that have the replacement sooner do much better than people that wait too long. The reason for this is the longer you wait, the more debilitated you become and the harder your recovery is. So we tell people to wait, but not wait too long. Okay, osteoarthritis of the hip can affect one hip or both hips. There are some very limited situations where you may consider doing both hips at the same time, but this is not commonly done. There's a slightly higher mortality rate when you do both hips at the same time. So for the most part, this is not recommended.